Hi, I'm Karen Kraska from US Pharmacist, and this month's patient teaching aid is all about blood pressure readings. Mounting evidence about the dangers of high blood pressure have prompted an update to the blood pressure guidelines in the United States. The new guidelines lower the threshold at which blood pressure is considered normal. They also define high blood pressure and the risk of heart disease and stroke. With the new guidelines, as many as 50% of U.S. adults may now be classified as having high blood pressure. Regular monitoring of blood pressure is the key, since many people are unaware that they have high blood pressure because there are no noticeable symptoms. Blood pressure is the measurement of the force of the blood as it's pumped through the blood vessels. It's measured by using a manual or an automated blood pressure cuff. A blood pressure reading has two numbers that represent the pressure at two different points in time: when the heart is contracting or beating, and when the heart is at rest between heartbeats. Blood pressure is considered in the normal range if it's less than 120/80. The top number is called systolic blood pressure, which is the pressure during a heartbeat. The bottom number is called diastolic blood pressure, and it represents blood pressure when the heart is at rest or between heartbeats. Low blood pressure is usually not serious, but high blood pressure has a negative impact on overall health. Evidence shows that even a modest 20 mm of mercury increase in systolic blood pressure and a 10 mm of mercury increase in diastolic blood pressure can double the risk of death from stroke, heart disease, and other vascular diseases. The American Heart Association and the American College of Cardiology have set guidelines for identifying elevated blood pressure, called hypertension. The current guidelines break hypertension into 5 categories based on level of risk and recommended treatment approach. In previous versions of the guidelines, 140/80 and above was considered hypertension. But you can see that these guidelines have lowered that to no greater than 130/80 for stage 1 hypertension. It's important to have regular checkups and blood pressure readings annually to assess your risk for hypertension and cardiovascular disease. If caught early enough, high blood pressure can be treated with lifestyle changes, such as weight loss, regular exercise, a low-salt diet, and stress relief. If stage 2 or high-risk stage 1 hypertension is present, blood pressure lowering medications are recommended. In all cases of elevated blood pressure, your doctor will reassess at 3 or 6 months. Blood pressure guidelines also recommend regular monitoring of blood pressure at home to identify elevated blood pressure early and to assess whether treatment is working. For the most accurate at-home results, be sure to use the same blood pressure measuring device each time, and make sure you're checking your blood pressure around the same time of day each time as well. All blood pressure readings should be recorded and shared with your doctor at regular or follow-up visits. This month's patient teaching aid reviews the new blood pressure guidelines and blood pressure management strategies. The teaching aid is available in our monthly publication and can also be found online at www.uspharmacist.com/teaching-aids. We hope this month's patient teaching aid helps you with your daily patient education activities. Tune in next month for the newest edition of the patient teaching aid from US Pharmacist.